Good afternoon, Central Florida. This is Dr. Ron Lynch, and as you know, I am a graduate student at the University of Florida, getting a master's degree in public health with a concentration in the environment and how the environment impacts all of us through public health. And one of the areas that I want to discuss with you today has to do with male infertility among farm workers. As part of my internship, I got involved with cooperative extension, and that aspect of the university work deals with land grants that were given to various universities with the obligation of bringing scientific information translated to the representation of that community. And today we're talking about male infertility among farm workers. And we'd like to cover how common it is in the general population compared to the farm worker community. We want to discuss some of the general causes. How might the exposure of pesticides impact male reproductive system? What is the proposed mechanism through which pesticides may damage sperm? What protective practices can male farm workers use to mitigate the damaging effects on sperm? And what are the implications for agricultural practices? Now, as we get into this discussion, I want to introduce a graduate of the University of Florida, and we're going to call her Miss Camille. Camille. How are you today, Camille?
I'm doing well. Thank you. Thank you for having me.
And I'm so glad that you could be here because you represent the audience today. You are going to be thinking the thoughts that our audience will have, and feel free to jump in where necessary. And I know that you had some question in your mind about public health. What in the world is public health? Am I correct?
No, absolutely. I feel that it is a term that is broadly used, but hardly understood, maybe all that it entails.
All right. Well, since you asked that question, Camille, I'm going to tell you that public health is the science of protecting and improving the health of communities and populations. Yeah, it's a broad term, but it involves a lot of activities. And for example, as a primary care physician, I didn't have anything to do with making sure that water was clean for the environment, or that air was pure, or that food was safe, and yet those are significant aspects of public health. What about the safe disposal of sewage? Every time you flush the toilet, how do we know where it's going? Is it going to in any way contaminate our drinking water? Public health has to do with better nutrition, teaching about healthy lifestyle choices, and bringing awareness and also the removal of known or unknown toxins. Now that's a lot. I think that really offers a different respect for what public health is all about.
Yeah, absolutely. I think most people, it would be difficult for them to fully grasp how much it impacts them on a daily basis.
And although we don't really talk about it a lot, 100 years ago, the lifespan of the average American was probably in the 50s or the 60s. And as a result of dealing with hygiene and cleanliness and some scientifically worked out methods, lifespan is now late 70s, 80. So in conclusion, the science and the art of preventing disease, prolonging life, promoting physical health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections like COVID, the education of the individual in principles of personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and the development of the social machinery which will ensure that every individual in the community will enjoy a standard of living adequate for the maintenance of good health. and that's a mouthful.
That is the
So,
goal, yes.
okay. So now that we understand a little bit more about the overarching concepts of public health, we want to get into male infertility. And many of us may not have realized that male infertility is a serious concern for public health. And we actually want to understand why it is that infertility appears to be increasing among farm workers, and that's according to epidemiological data. I'm going to give you the name of a couple of references that I pulled this information from because I certainly didn't have this information in my back pocket. So I'm speaking strictly from peer-reviewed scientific articles. But I'll give you a headline, and that is that the exposure to agrochemicals during farming activities is probably able to affect the function of the reproductive system, as revealed by this increasing worldwide evidence of male infertility amongst farmers.
Mm.
Any thoughts about that?
Yeah, my initial thoughts, I'm wondering kind of what is the lag time on identifying the initial issue and then seeing the results of the cancers later on, decades later sometimes. So it'll be interesting to know kind of the timeline of watching it all.
Okay. And before we get to the timeline, you know what just hit me was the fact that back in the 16th, 17th century, there were kings, probably over King Charles or King John, and their spouse was not able to have a baby, and the immediate blame went to the female. And in fact, there's a lot of emphasis
Right.
on the fertility or the fecundity.
Yep.
That's another word for fertility of women. But we've actually come to realize that men play an important role
Right.
in this creation. And if the male is bringing half of the chromosomes by way of sperm to the picture, well, we would hope that that sperm would be clean and motile, and it would be healthy. And so, yes, there should be a focus on the men, and that's where this is exactly going. So infertility is usually defined as the lack of ability to conceive a child after 12 months of unprotected intercourse. And it's been estimated that infertility affects somewhere between 37 to 70 million couples worldwide.
Wow.
And in 50% of the cases, it is or can be ascribed to being a male issue.
That's actually kind of shocking. I think you're right. Most people would attribute infertility issues maybe to the women and not so much the men. However, as we're learning now, it's almost 50%, which is higher than I would have imagined.
Mm-hmm. And what goes hand in hand with that is that we have lots of fertility clinics that have come up, erected all over the country. There is discussions about IVF and having surrogates to carry babies. So I wonder, is anything happening worldwide, even beyond the farm workers, in terms of an impact on our fertility?
Mm-hmm.
It's just a question, but hopefully we'll get some clearer understanding. So, what are some of the causes of infertility? Well, as it turns out, about 15% of couples in the U.S. struggle to conceive, and infertility is defined somewhat arbitrarily. And we repeated that again, but does that seem reasonable that you would try to have a baby over the course of an entire year of unprotected intercourse, and then if you still haven't come up with anything, that is when you can approach the urologist for men or the OBGYN doctor or a fertility specialist for the women. And they're saying that of the couples deemed infertile, 43 to 63% of women younger than 40 will usually conceive naturally within the second year of trying.
Hmm.
So what are your any thoughts about, anyone who's actually had that incredible disappointment of trying to have a baby and we're unsuccessful?
Oh, absolutely. Trying to get impregnated and also trying to carry the baby to full term. I mean, know a lot of women friends who have lost babies prematurely as well. That seems to be also a common um,
And
common issue.
what I can imagine, Camille, is the kind of stress that goes along with maybe trying for 3 months and nothing happening, and then they're just locked into a cycle of stress, which probably doesn't make the process any easier.
Correct.
And so, as we go further, I'm just going to highlight what types of conditions or what kinds of situations may make it more difficult for men to have healthy sperm. And so we understand that scientifically that if a male has diabetes, if he has cystic fibrosis or varicocele is actually a vein that is surrounding the testicles that may actually change the temperature that would not allow sperm to live at the correct body temperature. The varicocele theoretically would keep the sperm warmer than necessary, and that might actually
I see.
cause decay or denature of of the sperm. Other behaviors such as smoking, the use of marijuana,
Hmm.
the use of certain anabolic steroids like testosterone supplementation, the use of alcohol or the overuse of alcohol, the use
Mm.
of hot tubs, trauma. Sometimes football players or basketball players can
Wow.
be injured. There can be infections from prostatitis to urinary tract infections or gonorrheal or sexually transmitted infections, which could also impact the quality of sperm, chemotherapy, or radiation. So we see that there is a host of different influences that could impact fertility anyway.
No, yeah, that's actually kind of shocking. Those are a lot of those activities are kind of recreational. I don't think most people would think that they're maybe messing with their ability um, to reproduce. I don't think it would occur to people that it would have an effect on their.
So no wonder whether we're talking about baseball for guys or hockey or any number of contact sports, men will usually have some type of a protective gear in that genital area, and rightly so, because we sometimes joke about family jewels. They're trying to protect. One other interesting lead before we get into the actual issue of pesticides is the notion of electromagnetic fields. These electromagnetic fields may suggest, and there has been work done by the NIH, by the National Toxicology Group. This is a group out of Raleigh, Durham, where they have discovered that the use of wireless radiation like cell phones in the pockets could also have an impact on the quality and the motility and the volume of sperm. So there's a lot of factors that go into to play here, and so we don't want to completely blame everything on pesticides, but we do know that farm workers have that as a very direct exposure.
Correct.
And so it now follows that in order to disqualify is it the male or the female, the male goes to the urologist, and the urologist then has to do a semen analysis during which the number, the movement, and the morphology, that means the structure
Hmm.
of the sperm, is evaluated.
Is that something that's ever evaluated before there are issues, or is that something that is looked at by a doctor regularly, just as part of men's health?
Not typically. That's a good question. That seems like that should be part of a process, But to be honest, it's not a general practical procedure that happens. But I've got to tell you a little funny story. I didn't plan to tell you this, but years ago, uh, my then wife and I were about 6 months into having unprotected sex in order to have our first child.
Mm.
And she went to see her OBGYN that declared that she had a normal evaluation, that the problem was probably me. So I went to see a urologist because her test came back normal. And of course, I was initially slightly insulted that it could be me. Am I the problem?
But that's interesting, though. That
Yeah, so this really happened to me. So I go to see my urologist, and then he says, Ron, I think you may have a varicocele. That once again, that's kind of like a varicose vein that may be in that particular area of the body, which might impact temperature. I didn't really believe him, but I said, okay, all right. So, but he said, Ron, I need a sperm sample. So here, anyway, here's the rest of the story. He gives me a magazine, and he puts me in a dark room, and he says, well, we need a sample. And I said, excuse me, doc, but this is not going to work for me. And so I was living in Tacoma Park, Maryland. So I figured that the best thing that I could do is what I'm about to tell you. My wife and I, we copulated. I gathered a sample, and I had to quickly put it into a little container. I put that in a little brown bag, and I got in my car, drove to the subway, rushing to catch the train because they had to analyze this within the hour.
no, I was about to say this must be time sensitive.
Time sensitive. So I'm rushing, trying not to drop this specimen. I get on the train, and I'm looking around, and I'm saying to myself, if you people ever knew what was in this bag. Anyway, needless to say, I did get there in time, and they did do an analysis, and thank God things did check out. And in fact, I do have two children, so everything did work out. But yes, that was my opportunity to visit with the urologist and get things checked out. My son is 36, my daughter is 34, so that did work. In fact, she had something called a hysterosalpingogram, which somewhat opened up her fallopian tubes, and things did happen.